Thanks very much, guys. Now, our pharmacist Kathy Maher is here to answer your questions, and we have a lot of questions coming into Kathy, as always. First of all, we have Jane in Dublin. Jane is on the line. Hi, Jane.
Hi, how are you?
I'm good. What's your question?
I've had a vomiting bug since yesterday.
Oh, poor you.
Yeah. And I'm aches and pains. I've stopped the vomiting this morning, but I'm afraid to eat.
Okay, and you're just wondering what to take and all that, is it?
Yeah, exactly.
All right, Kathy.
Okay. What time did it come on at yesterday, Jane?
About 3 o'clock.
Okay, so you're just about hitting 24 hours now, and it's only now that you're beginning to feel a little bit better. Did you have a temperature with it as well?
Hot and cold. I didn't actually take my temperature, but
you
I
felt?
Yeah.
Okay, and so terrible to ask, but was there any diarrhea as well, or was it just
during the night? Yeah.
Okay.
Yeah.
The best thing, I mean, I know you're saying you feel you need to eat. At this point, you're best not eating anything too strong. Just dry toast, even very bland soup, and just take it really easily, because what can happen is if you eat too much, it might bounce back up, or the bacteria that's caused the bug mightn't be gone. Have you replaced your fluids?
I have. I've started drinking water earlier on, and it has stayed down.
Okay. What's really good at this stage is to use oral rehydration sachets, so they would be like Diorlite or Rehydrat. And what they'll do is they have the correct balance of salt and sugar, and they basically replace exactly in the concentration that your body has lost it in. So you'll feel your energy come back much quicker if you take some of those.
Okay.
Okay? And rest.
Thank you. Okay. Bye-bye.
You'll feel better soon, Jane.
Thank you.
All right. Thanks very much for getting in touch. We have another caller getting in touch here. Can a pregnancy test be accurate before you start your period, or do you have to wait to see if you have missed your period?
Okay, we talked about this one last week, and there are two types on the market. They would claim to be as accurate for up to 6 days in advance. The closer you wait to test, closer to your period is due, the more accurate any of the tests will be. They are the two that will work up to 6 days before, but even at that, there might be 80–85%. If you do wait until the day before or the day the period is due, it can be up to 98% effective.
Oh, great. So you're better off to wait until the day
Absolutely.
the period was due. Okay, but you can try if you want an early test, just in case.
If you try an early test and it's negative, it's not to say it's not going to be positive a few
try
days
in a couple of days.
Yeah.
Okay. Now, you just touched on this earlier on again. Is there a limit to how many times you can take the morning after pill?
Physically, there's not. Because certainly what it can do is delay a period coming, or can make a period heavier, bring it forward. And repeatedly that happening isn't great for the body, but it's eliminated from the body within a number of hours, so it's not physically bad for you. But what we would say there is the most important thing is to promote safe sex. So if a patient is finding that they are requesting the morning after pill on a regular basis, they need to look at their sexual habits and also long-term contraception, so to have a chat with their family planning clinic or their GP.
Okay, of course, since last week, the morning after pill is now available over the counter.
That's absolutely right. It came on Wednesday, the Irish Medicines Board changed it from prescription only to pharmacy. Okay. And you can go in now and have a private consultation with the pharmacist and avail of the morning after pill. So there's no need to queue up or wait, delay to see a GP.
And how much does it cost around?
It's been up to each individual pharmacist to charge. So I know there's varying degrees of prices out there, from as little as maybe €25–30 and upwards. So.
Okay, very good. All right, Dee from Kerry. My 7-month-old baby is starting the creche next week. Is there any supplement I could give her to boost immunity?
No. The main thing with that baby is, first of all, the baby's under 12 months, so she needs to be on a vitamin D supplement anyway to help prevent rickets. That's a new directive. That's a new directive came in January 2011 from the HSE Department of Health to make sure there's actually increasing rickets in children in Ireland at the minute because of our high sun factor, our poor sun exposure. So she needs to be on vitamin D supplement.
How much vitamin D would you take, though? What's the norm?
It's 5 micrograms.
So that's the RDA?
Yeah,
okay.
it's for a baby.
And how would you give a baby a supplement like that?
There are a few supplements available, vitamin D3 only available, and they're available from pharmacies.
Are they liquid?
Yeah, little drops, 2 to 5 drops, depending on the brand. But that baby now, to make sure it's 7 months, that baby will be weaned, to make sure that they've plenty of fruit and vegetables, plenty of protein, so that they're weaned appropriately.
It's amazing, isn't it, considering stuff like rickets, which are Dickensian type diseases are back. It's unreal.
Absolutely.
Another baby question here. My 4-week-old baby has a lot of spots on the face and some red and white spots. Is there any cream that can help?
There's a few creams. These come out usually within about 4 to 6 weeks of birth, and the baby has a lot of natural oils, the skin is just beginning to dry out. It's perfectly normal, looks a bit unsightly, and sometimes for first-time mums they get a bit panicked. They're really just called milk spots, and they tend to come all around the face.
Oh yes, I've seen those little white things, yeah.
Yeah, they look like little baby pimples. There's a very good cream called Elav, and I would have found it just very beneficial on my own children.
Okay.
So when you recommend from experience, you know it really, really works. So it's Elav, it's a baby intensive cream.
Okay.
They're very good at treating those.
And you can get those in the pharmacy. Mary from Kerry got in touch. I'm 51. Lately I've been getting very sore breasts on the left side. A very sore breast, she said, on the left side, going from my breast around the side. Very sore pain, I think she means there. Through her back, and it's very sore to touch and always happens around my period. Is there anything I can take to help?
I would refer Mary to her GP, because anything to do with breast pain, it's always worth getting checked out.
Okay.
Cyclical breast pain, when she talks about it happening just before her period, tends to affect both breasts. But I would go and get that checked just to be sure. She's 51. It could be a sign that she's beginning to enter menopause.
Yes,
could be a few things.
Sign, yeah.
So I would get that checked out. If everything proves out to be clear, then evening primrose oil, like we talked about last week, is very, very effective.
It's very effective. You need to be on that, of course, for a couple of months before it really takes
By
effect,
3
doesn't
months,
it?
yeah.
Okay, Sonia from Cork, what supplements could I take to prevent mouth ulcers and boost my general health?
An all-round multivitamin would be very good, but one that's enriched with vitamin C, which is very, very good for mouth ulcers, and also B-complex, again, just to help boost the immune system. So a general multivitamin with increased vitamin C.
What about L-lysine? I know that's been talked about before in relation to anything to do with mouth ulcers or cold sores.
That's very good for connective tissue and also for people that suffer from cold sores.
Great.
So very good to prevent recurring cold sores.
Thank you very much,
Okay.
Kathy, as always, a popular woman. Thanks very much, and we got through as many as we could.